Hello everyone, I am Dr. Dilip M. Babu, consultant nephrologist and transplant physician at Yashoda Hospitals, Somajiguda. So today I am going to discuss what are the treatment options for patients who are having chronic kidney disease, that is patients who are having permanent kidney damage. So most of these patients will have two options, either they have to go for kidney transplant or they have to remain on dialysis rest of their life. This is a common question among all patients who are having chronic kidney disease. So if you consider the quality of life and the survival, which is always better after kidney transplant, because the patients who are on dialysis, they have to do dialysis weekly thrice, they have to travel to the dialysis unit every week 3 times, and during dialysis also they face sometimes complications like low blood pressure, or sometimes blood pressure goes very high. There is a problem with the AV fistula or the access for the dialysis which might get failed during dialysis because of these fluctuations. They might have cramps. So these complications, and they are more prone for cardiovascular disease compared to the patients who undergo kidney transplants. So out of these two options, kidney transplant is always better. Kidney transplant will have better quality of life. They can take the regular medicines from their home. They will not require dialysis, and their survival compared to the dialysis patient is much better, and their quality of life is quite good after kidney transplant. Usually the donor should be from the family member, like patient's mother, father, brother, sister, or husband or wife. So who is having the same blood group will be preferred. Plus donor should not have any blood pressure, diabetes, or any heart disease or kidney issues in the past. The donor should be healthy. We will evaluate the donor completely before taking up for the transplant. We do all the investigations and check their fitness level and then plan for the kidney transplant. If some patients they don't have donor from the family member, so they have the options. They can get registered with the Jeevan Dan program, which is under Telangana government. So these patients can get registered in Jeevan Dan program, and they can wait for their transplant from the brain dead or deceased donor patients who come with in the hospital, like accident cases, they are willing to donate their organs. So if these people who are on dialysis, they will be on the waiting list for Jeevan Dan. After kidney transplant, their urine output will improve, their creatinine will become normal, but they have to take the immunosuppressive medications rest of their life. They have to undergo regular checkup, at least weekly once for first 3 months, and then once in a month afterwards. If they miss the medications, which is called immunosuppressive medications, the kidney might be rejected by their body, so they might come back to the dialysis. So they have to take regular medicines and regular follow-up. They have to take the necessary precautions to prevent the infections. So these are the necessary precautions they have to take after kidney transplant. Most of the people feel that kidney transplant is a very costly procedure compared to the dialysis. But if you see, the dialysis is costing more compared to the transplant, because weekly you have to travel to the dialysis unit at least 3 times a day. And during dialysis also they will have some complications, infections, the fistula failure, catheter infections, for which they will require multiple times of admissions and antibiotics. Sometimes these patients admit in emergencies with fluid overload or pulmonary edema or cardiac failure, for which they have to keep them in a ICU for 2 or 3 days. So they will spend more money in dialysis, and which is recurrent requirement of admissions, and the quality of life is poor if the patient remains on dialysis. So financially, kidney transplant is a one-time expenditure, and after that they have to regularly take the medicines, and they can stay at their home, they can do all their activities and work. So quality wise as well as cost wise, kidney transplant is always cheaper compared to the dialysis. Thank you.
Like, comment, and subscribe for more health updates.